Hey, welcome to our Sex by the Numbers with Sex Talk with Dr. Clark and Dr. Volker. And we're up to number 6 steps in sex response. That sounds like a lot, Dr. Volker.
I know some people like quickies, and then what will happen is they don't realize how complex, first of all, our bodies, fabulous machines are for sex response. Well, it all starts in the brain. I always tell people, I walk because my brain is working. I talk because my brain is working, and a sex response happened because brain is working. So you want to keep your brain safe, and for sure. And the brain is going to start, that hypothalamus tells the pituitary gland, go send down sex hormones, and that can be complex. And the spine has to be in place. So if somebody has a head injury or a disease that affects the brain, all right, there could be a difference in sex response. If the second one is the spine has to be in place to carry those messages, neurotransmitters down, and that part is going to be, if there's any difference in the spine, if somebody's got a back issue or somebody has had a back injury, that can affect or get interrupted, all right? And it depends on where that injury has been, higher or lower in the spine. But that's important, again, for people to know about their bodies. So we got the brain, we got the spine, and then the third one is the NTs, the neurotransmitters. They carry the messages down. All right. They carry, okay, all right, blood flow has to happen. Okay, neurotransmitters carry these messages. And then the fourth step is, how does my brain interpret it? Do I like it? Well, not so much. So fourth step is this, the interpretation of that. Or it's too hard, or a little harder. Okay, this part is exactly what, again, if people take time to know themselves and they're comfortable, okay, because we got the brain, we got the spine, we got the neurotransmitters, we got this reflex arc, okay, all right, and then your autonomic nervous system is responsible for your muscle contraction, orgasm, and then if someone's going to ejaculate, okay, it's either going to come from the prostate, okay, on a guy, or the Skene's glands inside the vagina, which some people call the G-spot, named after Dr. Grafenberg. But there could be liquid that comes out, and that's orgasm. And the last step is how you feel after. To me, that's the most important part, because you could have high arousal and then do all kinds of positions and then have these orgasms multiply and simultaneously, which for some people is work. However, if you feel shame or guilt or triggered after, that's the last thought in the brain. And that's what you're going to be taking with you into that next experience. Or I don't want to do that again. So it's important to learn about your sex response, either by yourself or talk to a sexologist who can help you, a sex therapist, with that. And there's a lot of wonderful YouTubes. And thank you, Dr. Clark, for having these resources available. Thank you.
Thank you, Dr. Volker.